Forget modern labs and blood tests. In the year 1350, a doctor's most important diagnostic tool was his own tongue. To check for diseases like diabetes, a physician would take a flask of the patient's urine and, believe it or not, take a sip. If it tasted sweet, like honey, you were diagnosed with the pissing evil. If it was bitter, you had a liver problem. These men were paid gold coins just to drink a stranger's warm waste. Now, that's a job description you won't find on LinkedIn today. Hello, welcome back. But before we dive into these blood-soaked chronicles, if you love uncovering the darkest corners of human history, hit that subscribe button and join our growing guild of history detectives. You don't want to miss what we're digging up next. Also, I'm curious, where exactly are you watching this from, and what time is it on your clock? Are you a fellow midnight historian watching in the dead of night? Drop your location and time in the comments below. I'll be hearting the best ones. Okay, imagine this for a moment. You're living in medieval Europe. Life is already rough, food is scarce. Winters are brutal, and disease is everywhere. One day you wake up feeling sick. Maybe it's a fever. Maybe your stomach hurts. Maybe you have an infected cut. Nothing dramatic, just sick enough to be worried. So someone suggests the most logical thing possible. We should call a doctor. Today, that sentence sounds comforting. Back then, it was often the moment everything went wrong. Here's the first uncomfortable truth. Medieval doctors didn't actually understand the human body. Not really. They didn't know about germs, bacteria, viruses, or infections. None of it. So, instead of asking what caused your illness, they focused on something else. Entirely something they believed controlled all health and sickness. They believed your body was ruled by invisible fluids called the four humours: blood, phlegm, yellow bile, and black bile. Health meant balance. Illness meant one of these fluids was too much, and once a doctor decided which one was the problem, the solution was almost never gentle. Here comes the shocking part. The most common treatment was to remove things from your body. Blood was the favorite. If you had a fever, they bled you. Headache, bled you. Infection, definitely bled you. Feeling weak? Ironically, they believed removing blood would make you stronger. And yes, patients often lost so much blood that they fainted, collapsed, or died. Yet doctors didn't see this as failure. If you got weaker, they believed the treatment was working. Another mind-blowing fact: pain was not considered a problem. Pain was expected. Enduring pain was seen as proof that the body was being corrected. There was no anesthesia, no painkillers. If a doctor cut you open, you were fully awake. Screaming wasn't unusual, it was normal. And if you're wondering whether doctors at least tried to keep things clean, bad news. Medieval doctors did not wash their hands between patients. Surgical tools weren't sterilized. Blood-covered instruments were common. Infection wasn't understood. So when patients died days later, doctors blamed the illness, not the treatment. Here's what makes this even scarier. People still trusted these doctors. They wore impressive robes, spoke Latin, and quoted ancient authorities. Confidence mattered more than results. In a world full of death, seeing a doctor felt like doing something, even if that something was slowly killing you. So the cruel irony of medieval medicine is this: you didn't fear the sickness nearly as much as you feared what the doctor might do once he arrived. And this is just the beginning. Next chapter, we'll talk about bloodletting in detail, how much blood doctors actually removed, who got bled the most, and why even kings nearly died from being treated. So let's talk about bloodletting, because you really can't understand medieval medicine until you understand how obsessed doctors were with removing blood from people who were already sick. To a medieval doctor, blood wasn't just a fluid. It was the most dangerous humor of all. Too much blood was believed to cause fever, aggression, madness, and even sinful thoughts. So if you showed almost any symptom, the safest solution in their minds was simple: open a vein and let it flow. Here's the shocking part. Bloodletting wasn't a small procedure. Doctors didn't remove a little sample, they removed large amounts, sometimes until the patient became pale, dizzy, or unconscious. In some cases, they believed fainting was the goal. If you passed out, it meant the excess blood had finally left your body. And no, this wasn't done with clean equipment. Doctors used knives, razors, or sharp metal tools that had been used on countless patients before you. No sterilization. No understanding of infection. Just cut, drain, and hope. Now here's a mind-blowing fact most people don't know. The sicker you were, the more blood they took. Severe fever, more bleeding, serious infection. Bleed again the next day. If the patient survived, the doctor took credit. If the patient died, it simply meant the illness was too powerful. Even worse, bloodletting wasn't limited to doctors. Barbers did it too. Yes, the same people who cut hair also cut veins. That's actually why barber poles are red and white. Red for blood, white for bandages. So if you couldn't afford a physician, a barber would happily drain your blood instead. And kings weren't safe either. This is another shocking reality. Wealthy patients often died faster because doctors were more aggressive with them. Powerful people received the most advanced treatments, which usually meant more bloodletting, more purging, and more extreme interventions. There are historical cases where royalty lost so much blood over several days that their bodies simply gave up, and still doctors believed they had done everything correctly. The scariest part, bloodletting continued for centuries. Even when patients clearly worsened, even when death followed treatment after treatment, the theory was never questioned, only the patient's strength was. So if you lived in the Middle Ages, getting sick didn't just mean fighting disease. It meant surviving the doctor's cure. And we're still not at the worst part yet. Alright? So imagine this. You somehow survived bloodletting. You're weak, pale, and barely standing. A modern person would think, okay, rest, food, water. A medieval doctor, he'd look at you and think, interesting. Now we need to cleanse you. And by cleanse, he meant make your body violently expel whatever was inside it. Here's the terrifying truth. Medieval doctors believed that sickness had to be forced out. If bloodletting didn't work, the next step was purging diarrhea, sweating, or salivation. If your body wasn't suffering, the medicine wasn't strong enough. So doctors prescribed substances that today we would label clearly and confidently as poison. One of the most commonly used medicines was mercury. Yes, actual mercury. It was believed to cure everything from skin diseases to sexually transmitted infections. Patients were told to ingest it, rub it into open sores, or inhale mercury vapor. Here's the mind-blowing part. When patients began drooling uncontrollably, losing teeth, and experiencing mental breakdowns, doctors saw this as a good sign. It meant the poison was working. Another popular treatment, arsenic. In small doses, it was believed to rebalance the humors. In slightly larger doses, it killed you. Medieval doctors didn't know the difference. Dosage wasn't science, it was guesswork. And if that didn't shock you enough, there's this: many medieval medicines were made from rotten plants, animal waste, or crushed insects. Dead mice, powdered skulls, dried worms, and fermented urine all appeared in medical recipes. The smell alone could make patients gag before the medicine even reached their stomach. Here's a brutal fact most people don't realize. If you survived the poison, doctors believed the cure worked. If you died, your body was considered too weak or sinful. The medicine was never blamed. Even worse, these toxic treatments were often combined. A patient might be bled, then poisoned, then purged all, while being denied proper food or rest. The body didn't fail because of disease. It failed because it was under assault. So when we say medieval doctors healed people, what they were really doing was testing how much suffering a human body could endure. And we still haven't talked about surgery yet. So let's go deeper into this idea. Medieval doctors were completely obsessed with the body must be cleansed. To them, sickness wasn't something you gently treated. It was something you drove out. If your body wasn't violently reacting, then clearly the disease was still inside you, laughing. That's why medieval medicine loved extremes. Gentle treatments felt suspicious. Mild reactions meant failure. Doctors wanted results they could see, smell, and hear: vomiting, diarrhea, sweating, drooling, bleeding. These weren't side effects, they were proof. Here's the first truly disturbing fact. Medieval doctors believed diarrhea was healing. If a patient took medicine and immediately ran to the toilet, the doctor smiled. It meant the bad humors were leaving the body. If the diarrhea didn't stop for days and the patient became dehydrated and delirious, that wasn't considered dangerous, was considered thorough. Laxatives were among the most commonly prescribed medicines in medieval Europe, and not gentle ones. These were powerful herbal mixtures designed to completely empty the intestines. Patients were sometimes purged, repeatedly over several days until they were too weak to stand. At that point, doctors believed balance was finally being restored. Now, imagine this happening to someone already sick, already malnourished, already dehydrated. The disease didn't have to kill them. The treatment often did. Another favorite method of cleansing was induced vomiting. Doctors gave patients substances that irritated the stomach so badly that vomiting was unavoidable. And if the patient didn't vomit hard enough, the dose was increased. Vomiting wasn't an accident. it was the objective. Here's a mind-blowing detail. The more violent the vomiting, the more successful the treatment was considered. If a patient vomited blood or bile, doctors believed the worst humors were finally being expelled. Modern medicine would call that an emergency. Medieval medicine called it progress. And then there was sweating. Doctors believed sweat could push disease out through the skin. So patients were wrapped in heavy blankets, placed near fires, or given hot medicines designed to raise body temperature. Fevers weren't cooled, they were encouraged. Some patients literally cooked themselves while already burning from illness. Here's the shocking part. If a patient died from overheating, dehydration, or organ failure, the doctor didn't see a mistake. The illness was blamed for being too stubborn. The treatment was never questioned. Now let's talk about the poisons again, because this is where medieval medicine becomes genuinely horrifying. Mercury deserves special attention. It was one of the most respected medical substances of the time. Doctors used it for skin diseases, parasites, and especially syphilis. Patients were told to rub mercury ointment into their skin until sores appeared. Others were forced to inhale mercury vapor. The side effects were horrific. Excessive drooling, mouth ulcers, teeth falling out, tremors, hallucinations, and madness. But here's the terrifying. Logic doctors believed these symptoms meant the disease was leaving the body. When a patient lost their teeth, it wasn't poisoning. It was purification. There are recorded cases where patients begged doctors to stop mercury treatments because they felt their minds slipping away. Doctors refused. Stopping treatment early meant failure. Better to risk insanity than leave disease inside the body. And mercury wasn't alone. Arsenic, antimony, and lead appeared in medieval medical recipes. These substances were carefully measured not with science, but with tradition and guesswork. A pinch too little meant ineffective. A pinch too much meant death. Doctors often didn't know which had happened. Here's a deeply unsettling fact. Medieval doctors often reused recipes even after patients died from them. A single death didn't discredit a treatment. Death was common, expected, normal. What mattered was whether the theory still sounded right, and the theory always sounded right. Now let's talk about ingredients that sound ridiculous. You realize people actually consumed them. Medical texts recommended powders made from crushed emeralds, ground pearls, powdered animal bones, dried worms, spiders, and even human skulls. Some medicines included animal feces or fermented urine. The logic was symbolic, not biological. If something looked strong, rare, or powerful, it must heal. One particularly disturbing practice involved using human remains as medicine. Powdered skull was believed to cure headaches and epilepsy. Fat from executed criminals was rubbed onto wounds. Blood from freshly killed animals or humans was, sometimes, drunk as a cure for seizures. Yes, really. The human body wasn't sacred in medieval medicine. It was an ingredient, and yet people still believed in these treatments. Why? Because sometimes, by pure coincidence, people survived. A patient might recover despite the poison, not because of it. And when that happened, the doctor took full credit. Survivorship bias kept medieval medicine alive. The dead couldn't complain. The survivors became proof. Here's another mind-blowing truth. Rest, hydration, and nutrition were rarely considered medicine. Letting the body heal itself seemed passive. Weak, real medicine had to do something. If a treatment didn't exhaust you, it didn't feel powerful enough. So patients were often denied food during treatment. Fasting was believed to help purging. Drinking water was sometimes restricted, so the body wouldn't retain humors. Weak patients were intentionally weakened further. From a modern perspective, it's horrifying. From a medieval perspective, it was logical. And this is the most chilling part of all. Many doctors truly cared. They stayed with patients. They monitored reactions. They adjusted treatments. They believed they were saving lives. That belief made them relentless. By the time medieval medicine finished with you, your body was often exhausted, poisoned, dehydrated, bleeding, and traumatized. The original illness barely mattered anymore, which leads us to the next nightmare. Because if poison and purging didn't work, doctors still had one option left: cutting you open. And medieval surgery was something you never, ever wanted to experience. Next chapter, we'll talk about surgery without anesthesia, without hygiene, and without mercy, where survival depended on speed, luck, and how loud you screamed. So at this point, let's be honest. If you were sick in the Middle Ages and a doctor showed up, your body was no longer yours. It became a battlefield, and the doctor's main strategy wasn't healing, it was removal. Remove blood, remove fluids, remove anything that looked, smelled, or felt wrong. Medieval doctors believed that sickness stayed inside the body, unless it was physically forced out. Resting and waiting felt lazy. Gentle care felt irresponsible. Real medicine had to be aggressive, visible, and exhausting. If a treatment didn't make you suffer, it simply wasn't strong enough. That's why purging became one of the most trusted medical practices of the medieval world. Purging meant forcing the body to empty itself through vomiting, diarrhea, sweating, or excessive salivation. And doctors didn't choose just one. They often used all of them together. Here's the first disturbing fact. Diarrhea was considered a sign of success. The longer it lasted, the better the doctor felt about the treatment. If a patient had severe diarrhea for days and became dangerously dehydrated, medieval doctors didn't see danger, they saw efficiency. The bad humors were leaving. That was all that mattered. Laxatives were everywhere. Herbal mixtures, bitter brews, thick pastes designed to violently irritate the intestines. These weren't mild remedies. They were designed to overwhelm the body. Patients were sometimes purged, repeatedly over several days until they could barely stand, barely think, and barely speak. From a modern perspective, it's horrifying. From a medieval perspective, it was logical. If illness came from excess, then removing as much as possible must be the cure. Vomiting was treated the same way. Doctors intentionally gave patients substances that triggered intense nausea. Vomiting wasn't an accident, it was the goal. And if the patient didn't vomit strongly enough, the doctor increased the dose. Here's a truly mind-blowing detail. Vomiting blood or bile was not considered a warning sign. It was considered proof that the deepest, most dangerous humors were finally being expelled. Today, we'd rush that patient to an emergency room. Back then, the doctor would nod in satisfaction, and then there was sweating. Medieval medicine believed sweat could push sickness out through the skin, so patients were wrapped in heavy blankets, placed near fires, or locked into overheated rooms. Fever wasn't treated, was encouraged. Doctors believed heat helped the body cook the disease out. Some patients were already burning with illness. The treatment added even more heat. Dehydration, heat exhaustion, and organ failure followed. But again, if the patient died, the illness was blamed. The treatment was never wrong. Now let's talk about poisons. Again, because this is where medieval medicine crosses from ignorance into genuine nightmare fuel. Mercury was one of the most respected substances in medieval medicine. Doctors used it to treat skin diseases, parasites, and especially sexually transmitted infections. Patients were told to rub mercury ointment into their skin until sores appeared. Others were forced to inhale mercury vapors in closed rooms. The effects were horrific. Excessive drooling, mouth ulcers, teeth, loosening and falling out, tremors, confusion, hallucinations, madness. Here's the terrifying logic. These symptoms were interpreted as success. Drooling meant the poison and, therefore, the disease was leaving the body. Losing teeth wasn't poisoning. It was purification. There are historical accounts of patients begging doctors to stop mercury treatments because they felt their minds slipping away. Doctors refused. Ending treatment early meant failure. Better to risk insanity than allow illness to remain inside the body. Mercury poisoning could last for months. Patients suffered long after treatment ended. But if they survived, the doctor took credit. And mercury wasn't alone. Arsenic, antimony, and lead were also used as medicine. These substances appeared in recipes passed down through generations. Dosage wasn't calculated scientifically. It was estimated based on tradition, experience, and guesswork. A little too little meant ineffective. A little too much meant death. Doctors often didn't know which one had happened. Here's another chilling fact. A treatment wasn't abandoned just because it killed someone. Death was common. Expected, one dead patient didn't discredit a remedy. If the theory still made sense, the treatment continued, and the theory always made sense to doctors. Now let's talk about the ingredients that sound absurd until you realize people truly consumed them. Medieval medical texts are full of recipes involving crushed insects, dried worms, spiders, animal bones, and even animal waste. Some medicines included fermented urine or feces. The logic wasn't biological, it was symbolic. If something was rare, powerful, disgusting, or difficult to obtain, it must be effective. One of the most disturbing practices involved human remains. Yes, people drank blood as medicine. In medieval medicine, the human body wasn't sacred. It was a resource. And yet despite all this, people continued to trust doctors. Why? Because sometimes people survived. A patient might recover despite the poison, not because of it. When that happened, the doctor received all the credit. The dead couldn't argue. The survivors became proof that the treatment worked. This is something modern audiences often underestimate. Survivorship bias kept medieval medicine alive. Failures were forgotten, successes were celebrated, and no one tracked statistics. Another mind-blowing truth: rest, hydration, and nutrition were rarely considered treatment. Letting the body heal itself felt passive, weak. Real medicine had to act, so patients were often denied food during treatment. Fasting was believed to help purging. Drinking water was restricted so the body wouldn't retain humus. Weak patients were intentionally weakened further. If you think about it long enough, medieval medicine starts to feel less like healing and more like endurance testing. And here's the most chilling part of all. Many doctors truly believed they were helping. They stayed with patients. They adjusted doses. They monitored reactions. They followed rules. They trusted ancient authorities. They weren't sadists, they were convinced. Professionals working within a broken system. That belief made them relentless. If you cried, they continued. If you begged, they increased the dose. If you survived, they were right. If you died, the illness was cruel. By the time medieval medicine finished with you, your body was often poisoned, dehydrated, bleeding, starved, and traumatized. The original disease almost didn't matter anymore. The treatment had become the real danger, and when poison and purging failed, there was still one final option left. The most terrifying one: surgery. No anesthesia, no sterilization, no mercy, and that's where we're going next. All right? Take a breath, because this is where medieval medicine stops being disturbing and starts being terrifying. You've been bled. You've been poisoned. You've been purged, starved, dehydrated, and weakened. And somehow, against all odds, are still alive. At this point, a medieval doctor might look at you and think, well, we've tried everything else, which means there's only one option left. Surgery? Now, if the word surgery makes you picture bright lights, sterile rooms, gloves, anesthesia, and careful precisionaries, all of that immediately. Medieval surgery was none of those things. It was fast. It was brutal, and it was performed on fully conscious human beings. Let's start with the most shocking reality. There was no real anesthesia, no general anesthesia, no local anesthetic, no pain management as we understand it today. At best, patients were given alcohol, herbal sedatives, or opium-like substances, but these were unreliable and often unavailable. Many patients felt everything. If you were lucky, you passed out from pain or blood loss. If you weren't, you stayed awake. Doctors didn't expect patients to be comfortable. Pain was assumed. Enduring pain was considered part of the process. Screaming wasn't unusual, it was background noise. And yes, patients were often physically restrained, because surgery wasn't delicate. It was violent. Medieval surgeons weren't praised for precision. They were praised for speed. The longer a surgery took, the greater the chance the patient would die from shock, blood loss, or infection. So surgeons trained themselves to work as fast as possible. Amputations could take minutes, sometimes seconds. A skilled surgeon could remove a limb before the patient bled out or lost consciousness. That speed was admired, celebrated. Here's the chilling part. Accuracy mattered less than finishing quickly. If something was cut wrong, it was already too late to fix it. Once the cutting started, there was no going back. Another mind-blowing fact: many medieval doctors didn't perform surgery at all. Why? Because surgery was considered manual labor, therefore beneath educated physicians. So who did the cutting? Barber surgeons. Yes, barbers. The same people who shaved beards and cut hair also. Drained abscesses, pulled teeth, removed tumors, amputated limbs. That famous red and white barber pole, it comes from blood and bandages. So if you needed surgery, you weren't necessarily being treated by a university-trained doctor, but by someone whose main qualification was steady hands and experience. And experience often meant learning by doing, on living people. Now here's where things become almost impossible to imagine. Medieval surgeons did not sterilize their tools. Knives, saws, hooks, needles used again and again without cleaning beyond maybe wiping off visible blood. Hands weren't washed between patients. Gloves didn't exist. Surgical rooms weren't clean spaces. They were just rooms. Sometimes surgeries were performed in homes, sometimes in barber shops, sometimes in open air. Infection wasn't understood, so when wounds turned black, oozed pus, or smelled rotten days later, surgeons didn't think this came from bacteria. They thought the body is reacting, or worse, the disease was too strong. Let's talk about amputation, because this was one of the most common and feared medieval surgeries. If you had a badly infected wound, gangrene, or severe injury, doctors believed removing the limb was the only way to stop death from spreading. And sometimes they were right, but the process itself was horrific. The patient was restrained. A tourniquet might be applied. The surgeon remembered. The limb was cut off with a saw or knife. No anesthesia, no antibiotics, no sterile bandages, just raw pain, blood, and speed. Here's the shocking part. Many patients survived the amputation, but died afterward from infection, shock, or blood loss. But if they died days later, the surgery wasn't blame. The disease was survival wasn't measured in years. Sometimes it was measured in hours. Mind-blowing fact, surgery was sometimes done as entertainment. Yes, really, public surgeries weren't uncommon. People gathered to watch. Apprentices learned by observing. Crowds sometimes formed. Pain was visible. Screams were public. The human body was a lesson, and the patient had no choice. After surgery, wounds were treated in ways that sound insane today. Hot oil was sometimes poured into wounds to seal them. Cauterization, burning flesh, was common. Open wounds were packed with herbs, dirt, or animal fat. Doctors believed pus was a good sign. Yes, pus, comma. It was called laudable pus. Thick, white discharge meant healing. Clean wounds that didn't ooze were considered suspicious. So, if a wound became infected, that was reassuring. Modern medicine would panic. Medieval medicine relaxed. Now we reach one of the most disturbing surgical practices of all. Trepanation. This involved drilling or cutting a hole into the skull. Why? To release pressure, to let out evil spirits, to cure headaches, epilepsy, or madness. Patients were fully awake. The skull was scraped or drilled until bone gave way. Sometimes patients survived. Sometimes they didn't. And when they did survive, it reinforced the belief that the procedure worked. Survivorship bias again. The dead didn't get a vote. At this point, you might be wondering, how did anyone survive medieval surgery? The answer is uncomfortable. Some people were lucky. Some had strong immune systems. Some wounds were cleaner by accident. Some surgeons were genuinely skilled, and sometimes doing nothing would have killed the patient anyway. So when someone survived surgery, it felt miraculous. Doctors didn't see the failures clearly because death was everywhere. People died from disease, childbirth, injuries, famine. Surgery was just another risk in a dangerous world. Here's the most chilling part of medieval surgery. Doctors and surgeons truly believed they were helping. They weren't monsters. They weren't torturers. They were professionals working with the knowledge they had. And that knowledge told them pain was unavoidable. Infection was fate, and suffering was part of healing. So when they cut into living bodies while patients screamed and begged, it wasn't cruelty. It was confidence. And confidence, when it's wrong, is deadly. By the time medieval medicine reached surgery, survival depended on luck, strength, and how quickly the surgeon's hands moved. If poison didn't kill you, if purging didn't destroy you, if blood loss didn't finish you, the knife might. And next chapter, we'll talk about something just as frightening but quieter. Diagnosis based on astrology, superstition, and vibes. Here's something that still feels unreal when you really think about it. In medieval medicine, your treatment didn't just depend on your symptoms. It depended on the sky. Doctors genuinely believed the universe controlled your body, and if the planets weren't aligned correctly, healing was impossible. So before touching you, many doctors didn't examine your wound or check your fever. They checked astrological charts. Your birth date mattered. The current moon phase mattered. The position of Mars, Saturn, and Jupiter mattered. If the stars said, "Not today," your treatment was delayed. If you were dying, one of the most shocking facts is this: bloodletting was forbidden on certain days. Not because it was dangerous, but because the stars said no. Doctors believed cutting the body while a certain zodiac sign ruled a body part could cause instant death. So, if the moon was in Aries, doctors avoided touching your head. If it was in Taurus, your neck was off. Imagine bleeding internally while your doctor waits for the moon to move. Even worse, astrology didn't just guide timing, it guided diagnosis. If you were melancholic, depressed, or anxious, doctors didn't look for trauma or illness. They blamed Saturn's influence. Aggressive behavior, too much Mars, laziness, or sadness. The stars had cursed your temperament. Mental illness wasn't treated as a medical condition. It was treated as cosmic imbalance, and the cure wasn't therapy or care, it was more purging, more bleeding, or prayer. Here's a mind-blowing detail. Some doctors believed diseases came from eclipses. If an eclipse had recently occurred, it was blamed for outbreaks of plague, fevers, or madness. Doctors recorded celestial events alongside patient deaths, convinced the universe itself was responsible. So when treatments failed, doctors didn't question medicine. They blamed the heavens. Another terrifying reality is how diagnosis actually worked. Many doctors never touched the patient at all. They diagnosed illness by examining urine, the color, smell, thickness, and even bubbles in urine were believed to reveal everything about your body. Entire books were written explaining what each shade of yellow or brown meant. Some doctors didn't even need the patient present. Families brought urine samples to the doctor, and he made life or death decisions without seeing the sick person once. If the urine looked wrong, the prognosis could be grim even if the patient felt fine. And if the doctor predicted death, that belief alone could seal your fate. Patients often lost hope immediately. In a time when belief was powerful, expecting to die often meant you did. Religion made everything heavier. Doctors believed God controlled illness. Disease could be punishment for sin. Healing required repentance as much as medicine. So alongside toxic treatments, patients were told to confess, pray, and accept suffering humbly. Pain wasn't just physical. It was spiritual. Refusing treatment or questioning it could be seen as defying God's will. So even when patients sensed something was wrong, they obeyed. Trusting the doctor meant trusting divine order. Here's another unsettling fact. Failure never discredited a doctor. If a patient lived, the doctor was skilled. If the patient died, God had chosen that outcome. Either way, the doctor remained respected. This meant medieval medicine never corrected itself. There was no feedback loop, no accountability. Death proved nothing, and this might be the darkest truth of all. Medieval doctors believed certainty mattered more than truth. Speaking confidently using Latin, quoting ancient authorities, referencing the stars made patients trust them. Doubt was dangerous. Confidence was comforting, even when it was deadly. So your life wasn't decided by science. It wasn't decided by evidence. It wasn't even decided by skill. It was decided by tradition, superstition, belief, and the position of distant planets that didn't care whether you lived or died. And somehow, people still believed this was the best medicine available. In the next part, we'll talk about who survived medieval medicine, why survival often had nothing to do with doctors at all. Let's pause for a second and ask the question nobody in the Middle Ages could answer honestly: who actually survived medieval medicine? Because despite everything we've talked about, poison, purging, surgery without anesthesias, some people did survive. Not many, but enough to keep the entire system alive for centuries. The uncomfortable truth is this: people survived medieval medicine mostly by accident. Not because the treatments worked, but because the human body is incredibly resilient. If your illness was mild enough, your body could heal itself despite the treatment. And when that happened, the doctor took the credit. This is the first mind-blowing fact most people miss. Medieval medicine didn't need to work consistently to survive. It only needed occasional survivors. There were no statistics, no controlled trials, no comparisons. One dramatic recovery outweighed 10 quiet deaths. Survivors became proof. The dead became silence. And silence was everywhere. Now here's where things get really interesting. The people most likely to survive medieval illness were often the ones who, avoided doctors entirely. Peasants who couldn't afford treatment, people living far from cities, or those who relied on basic rest, food, and time sometimes had better odds than those who received professional care. It sounds absurd, but in a world where doctors weaken patients on purpose, doing nothing could be a survival strategy. This leads to one of the darkest ironies of medieval history. The richer you were, the more dangerous medicine became. Wealthy patients had access to the most aggressive treatments, multiple doctors, repeated bloodletting, exotic poisons, elaborate regimens. The poor got nothing, and sometimes nothing was safer. There are recorded cases of nobles being bled multiple times a day while their bodies collapsed under the strain. Meanwhile, poor villagers with the same illness recovered slowly on their own. When nobles died, it was called fate. When peasants survived, it was ignored. Another shocking reality: children sometimes survived better than adults, not because doctors treated them gently, but because doctors often avoided extreme procedures on very young children out of fear they wouldn't survive treatment. Less intervention sometimes meant better outcomes. So survival often depended on one thing: how much the doctor interfered. Let's talk about immunity, because medieval people didn't understand it, but it mattered more than anything else. People who survived childhood diseases often developed strong immune responses. These individuals could endure infections that killed others. When they survived medical treatment, doctors believed their methods worked. In reality, the patient's body did all the work. This created a dangerous illusion. Doctors mistook natural recovery for medical success, and because recovery did sometimes happen, the system never collapsed. Here's a deeply unsettling fact: medieval doctors rarely followed up with patients. If you survived, you disappeared back into life. If you died, the doctor moved on. There was no long-term observation, no learning from outcomes. Medicine existed in isolated moments, not continuous care. That meant bad treatments didn't look bad. They just blended into the background of a deadly world. Now let's talk about gender, because survival wasn't equal. Women were especially vulnerable to medieval medicine, particularly during childbirth. Pregnancy and labor were treated as medical events filled with superstition. Midwives often knew more through experience, but male doctors increasingly replaced them with theory-based practices that ignored real anatomy. Bloodletting was sometimes used on pregnant women. So were purges. Pain was expected. Death was common. And here's a horrifying truth: women's pain was often dismissed as natural or necessary. Complications were blamed on moral weakness, sin, or emotional instability. Survival depended more on luck and the skill of midwives than on any formal medical knowledge. Another group with better odds: people who healed quietly, those who rested, stayed warm, ate when they could, and avoided invasive treatments. Sometimes recovered, without ever becoming medical. Cases: medieval medicine was loud, violent, and visible. Quiet healing didn't fit the narrative. Now let's talk about something that kept medieval medicine alive far longer than it deserved: authority. Doctors weren't just healers. They were intellectuals, they spoke Latin, they quoted ancient texts, they wore robes, they looked convincing. In a world where few people could read, appearance mattered more than results. If a doctor said, "This is how the body works," who was going to argue? Disagreeing with a doctor wasn't just risky, it was socially dangerous. Questioning medical authority could make you look ignorant, rebellious, or even sinful. So even when people suspected treatments were harmful, they obeyed. Here's another mind-blowing detail. Patients often blamed themselves when treatments failed. If medicine didn't work, they believed they hadn't suffered enough, prayed hard enough, or obeyed fully. Guilt replaced doubt. The system protected itself. And the doctors, they rarely doubted themselves. Medieval medicine valued certainty over curiosity. Asking questions meant admitting ignorance. Admitting ignorance meant weakness. So doctors clung to tradition, even when reality contradicted it. This is why change came so slowly. It wasn't until centuries later, when anatomy was studied directly, when dissections became accepted, when observation began to matter, more than ancient authority, medicine started to shift. But in the medieval world, tradition was stronger than evidence. Here's something that feels almost tragic when you think about it. Many medieval doctors were intelligent, compassionate people. They weren't cruel. They didn't enjoy suffering. They truly believed they were helping. That belief made them persistent, and persistence made them dangerous. When a treatment failed, they didn't think, "This doesn't work." They thought, "We must do more." More blood, more poison, more pain. Survival, when it happened, felt miraculous. Doctors believed miracles proved their methods were correct. Patients believed survival proved obedience was rewarded. Nobody questioned the system. And that's the final, chilling truth of medieval medicine. It didn't need to heal it, only needed to explain suffering. It gave people a story. It gave pain meaning. It gave death a reason. In a world where death was everywhere, explanation mattered more than cure. So when we ask who survived medieval medicine, the answer isn't flattering. The lucky survived, the strong survived, the untouched survived, the ignored survived, and sometimes survival had nothing to do with medicine at all. In the next chapter, we'll look at what finally broke this system, the moments when people began to realize something was deeply wrong, and how the slow, painful birth of real medical science began. At this point, you might be wondering something very reasonable. If medieval medicine was so dangerous, so ineffective, and so often deadly, why didn't people abandon it? Why didn't entire generations look around at the bodies piling up and think, maybe the doctors are the problem? The answer is unsettling, because it has very little to do with intelligence and everything to do with fear, authority, and how humans make sense of suffering. In the Middle Ages, death wasn't rare. It wasn't shocking. It was normal. Children died young. Adults died suddenly. Women died in childbirth. People died from small cuts, bad water, and simple infections. When death is everywhere, it becomes difficult to see patterns. Medicine didn't stand out as unusually deadly, it blended in. This is the first brutal truth. Medieval medicine survived because death already felt inevitable. When people expected death, they didn't demand proof of effectiveness. They demanded explanation, and medieval medicine gave them one. Doctors didn't just treat bodies. They told stories, stories about balance, humors, planets, divine will, and ancient wisdom. These stories made suffering feel meaningful. Random pain became ordered pain. Chaotic death became understandable death that mattered more than survival. Another uncomfortable fact is that most people never experienced enough medicine to compare outcomes. Villagers might see a doctor once or twice in their entire lives. If they died afterward, it didn't feel statistically meaningful. It felt personal, tragic, but not systemic. Without records, without data, without comparison, medicine couldn't fail publicly. It only failed privately. And private failure is easy to ignore. Comma. Now let's talk about something even more powerful than ignorance: authority. Medieval doctors were among the most educated people in society. They spoke Latin. They wore robes. They studied ancient texts. They quoted names nobody else could read. In a largely illiterate world, this created enormous psychological power. If a doctor said, "This is how the body works," there was no alternative explanation to challenge it. Disagreeing with a doctor didn't make you skeptical, it made you foolish. And worse than foolish, sinful. Religion wrapped itself tightly around medicine. Illness was often seen as God's will. Healing required obedience, humility, and suffering. If treatment failed, it wasn't because medicine was wrong, it was because God had decided otherwise. This belief system was airtight. If you lived, medicine worked. If you died, God chose it. There was no scenario where medicine was truly at fault. Here's a mind-blowing detail. Doctors benefited from failure almost as much as success. When a patient died, the doctor's reputation often didn't suffer. In fact, treating very sick patients could increase prestige. It made the doctor look brave, experienced, and trusted. Success built reputation. Failure built mystique. Now let's talk about pain, because pain itself reinforced belief. Medieval treatments hurt a lot, and humans instinctively associate pain with seriousness. If something hurts badly, it feels important, meaningful, effective. A treatment that didn't hurt felt suspicious. So when a doctor cut, burned, bled, purged, or poisoned you, the pain itself convinced you that something powerful was happening. Suffering became evidence. This is one of the most disturbing psychological truths of medieval medicine. The worse you felt, the more you believed the treatment was working. And if you died, your suffering was seen as proof that the illness had been real, not that the treatment had been wrong. Another reason medieval medicine survived is something we still struggle with today: survivorship bias. People remembered the one person who survived a brutal treatment. They forgot the 10 who died quietly. Stories spread about miracles, not failures. Memory favored hope. He survived after bloodletting. She recovered after purging. He lived even after surgery. Nobody said they survived despite it, because the dead couldn't tell their version. Now consider how medicine was taught. Medieval doctors didn't learn by experimenting. They learned by memorizing ancient texts: Galen, Hippocrates, Avicenna. These names carried absolute authority. If an idea came from an ancient source, it was considered proven. Questioning ancient medicine wasn't curiosity, it was arrogance. So even when real bodies contradicted theory, doctors trusted books over blood. They believed the body was wrong before they believed the text was wrong. This is a chilling thought. Medieval doctors trusted dead authors more than living patients, and because of that, medicine barely evolved. Change did happen, but slowly, painfully, and often secretly. Some doctors noticed patterns. Some realized bloodletting weakened patients. Some saw infections spreading after surgery. But openly challenging medical doctrine could destroy careers. So doubts stayed quiet. Another factor that kept medieval medicine alive was lack of alternatives. There was no competing system of science-based care. Folk healers existed, but they were dismissed as uneducated. Midwives had practical knowledge, but they lacked status. Real improvement required tools that didn't yet exist: microscopes, sterilization, anatomical knowledge. Without better explanations, even bad medicine felt better than none. Here's another deeply unsettling fact. Patients often became emotionally attached to their doctors. When someone is suffering, certainty is comforting. Doctors provided confidence, structure, ritual, treatment schedules, dosages, rules, prognoses. Even when those rules caused harm, they felt reassuring. Chaos feels worse than pain, and doctors understood this instinctively. They spoke with confidence. They avoided doubt. They framed outcomes in ways that preserved trust. Medicine wasn't just a science, it was performance. Now let's talk about guilt. When medieval treatments failed, patients and families often blamed themselves. They hadn't followed instructions perfectly. They hadn't prayed enough. They hadn't confessed fully. They hadn't suffered humbly. This internalized blame protected medicine from criticism. The system didn't fail you. You failed the system. That belief is powerful and destructive. It also explains why people didn't rebel. Refusing treatment wasn't brave. It was dangerous socially and spiritually. You risked being seen as ungrateful, rebellious, or sinful. In extreme cases, rejecting medical advice could be interpreted as rejecting divine order. So even when people feared doctors, they still obeyed them. Fear didn't break trust. It reinforced it. And here's the most tragic part of all. Many doctors truly cared. They weren't monsters. They didn't enjoy suffering. They stayed with patients. They tried again and again. They followed rules because they believed rules saved lives. Their compassion made them persistent. And persistence inside a broken system is deadly. By now, it should be clear that medieval medicine didn't survive because it healed people well. It survived because it fit the world people lived in. A world where death was common. A world where authority mattered more than evidence. A world where explanation mattered more than cure. Medicine reflected that world perfectly. And that's why it took centuries for things to change. Not because people were stupid, but because the system felt stable, meaningful, and inevitable. But cracks did begin to form. People started noticing patterns they couldn't ignore. Surgeons who washed their hands saw better outcomes. Doctors who questioned bloodletting saw patients survive. Anatomists who dissected bodies discovered organs didn't match ancient texts. Reality began to whisper, then speak, then scream, and when that happened, medieval medicine didn't collapse overnight. It resisted, it fought back, it clung to authority, but eventually it lost. And that's where we're headed next. In the next chapter, we'll talk about the slow, brutal death of medieval medicine and the moments when people finally admitted that centuries of healing may have done more harm than good. For centuries, medieval medicine didn't just survive, it ruled. It dominated bodies, minds, and belief systems so completely that questioning it felt almost unthinkable. But no system built on bad assumptions lasts forever. Eventually, reality pushes back. Quietly at first, then relentlessly, and that's exactly what began to happen. Not because doctors suddenly became smarter, not because people suddenly cared more, but because the human body kept telling the same story over and over again, and some people finally started listening. The collapse of medieval medicine didn't come from one discovery. It came from thousands of small contradictions that became impossible to ignore. One patient survived when he shouldn't have. Another died when the theory said he wouldn't. One surgeon broke the rules and got better results. And slowly, something terrifying happened to medieval doctors. They began to doubt. That doubt was dangerous, because medieval medicine wasn't just wrong, it was confidently wrong. And confident systems don't collapse quietly. They resist, they punish, they deny. So when reality started pushing back, medieval medicine fought it with everything it had. The first cracks appeared in the most uncomfortable place possible: anatomy. For centuries, doctors relied on ancient texts to explain how the body worked. Galen's writings were treated like scripture. But there was one problem: Galen had never dissected a human body. His anatomy came mostly from animals. And animals are not humans. When dissections slowly began to have an off, secretly discovered something shocking. Organs weren't where the books said they were. Blood vessels didn't behave the way theory predicted. The liver didn't control everything. The heart wasn't just a heat source. The body didn't match the text. That should have been a turning point. Instead, many doctors chose to believe the body was wrong. Yes, really. There are recorded cases of doctors standing over a dissected corpse, seeing organs clearly contradict ancient descriptions, and concluding that the corpse must be abnormal, deformed, defective, a mistake, because accepting that Galen was wrong meant accepting that centuries of medicine had been built on fiction that was too terrifying to face. But reality didn't stop. Surgeons began noticing something else, something deeply inconvenient. Patients who underwent less aggressive treatment sometimes survived more often. Wounds that were left alone occasionally healed better than wounds packed with substances. Burned with hot oil or aggressively drained, surgeons who washed visible dirt from wounds even without understanding germs saw fewer infections. This wasn't theory. It was pattern, and pattern is dangerous to bad medicine. One of the most mind-blowing facts is this: some medieval surgeons accidentally discovered antiseptic practices centuries early, then abandoned them because they didn't fit accepted theory. Clean wounds healed better. dirty wounds festered. But because no ancient text explained why, these observations were dismissed as coincidence. Medicine preferred explanation over outcome. Then came the plague, and everything changed. The Black Death didn't just kill millions, it humiliated medieval medicine. Doctors tried everything: bloodletting, purging, astrology, prayer, burning herbs, carrying flowers, wearing beaked masks filled with spices. Nothing worked, nothing even slowed it. For the first time, medicine failed publicly and universally. Doctors died alongside patients. Physicians fled cities. Treatments were abandoned mid-confidence shattered. And here's the shocking part. Some people noticed that doctors were completely powerless. Not ineffective, powerless. That realization lingered. Even after the plague passed, something had shifted. People still trusted doctors, but the absolute certainty was gone. Medicine no longer felt invincible. Fear cracked faith. Another blow came from an unexpected place: surgery. Surgeons long treated as inferior to physicians started outperforming them in practical outcomes. While physicians argued theory, surgeons worked with real bodies, bleeding bodies. They noticed that cutting less sometimes saved lives, that speed mattered, that cleanliness mattered, that not following every rule could be beneficial. This created a quiet rebellion. Surgeons didn't write philosophical texts. They learned through scars and survival, and their success was visible, which made physicians uncomfortable. A hierarchy built on books doesn't like being challenged by experience. Then something truly revolutionary happened. Doctors started observing instead of explaining. This sounds simple. It wasn't. Observation meant admitting you didn't already know the answer. It meant watching outcomes without immediately forcing them into existing theories. This was radical. Some doctors began recording what actually happened to patients, instead of what should have happened. According to theory, they compared cases, they noticed repetition, they noticed failure patterns. And once you start doing that, medieval medicine becomes impossible to defend, because the numbers don't lie. Bloodletting didn't consistently save lives. Purging weakened patients. Aggressive treatment increased mortality. Reality didn't care about ancient authority, but medieval medicine didn't surrender. It fought back. Doctors who questioned tradition were mocked, ignored, or accused of arrogance. Some lost positions. Others were accused of disrespecting sacred knowledge. Progress wasn't just slow, it was actively resisted. Why? Because medicine wasn't just about healing. It was about identity. Doctors weren't just wrong, they were built on wrongness. Their education, reputation, and authority depended on the old system. Admitting failure meant admitting their entire worldview was broken. That's not something humans do easily. Here's another mind-blowing truth. Some of the earliest voices against medieval medicine came from outside medicine. Artists noticed anatomy errors. Butchers understood muscle and bone better than scholars. Midwives knew childbirth realities better than physicians. Practical knowledge quietly undermined academic authority. Reality kept leaking in from places medicine refused to look. Eventually, the pressure became too much. Dissections became more accepted. Anatomy books were rewritten. Blood circulation was discovered. Organs were redefined. Medicine slowly stopped asking, "What did the ancients say?" and started asking, "What actually happens?" This didn't feel like progress at the time. It felt like betrayal. Doctors accused reformers of destroying medicine, of abandoning wisdom, of playing God, of being dangerous. Ironically, those accusations would later be used against medieval medicine itself. The most shocking part of all, nothing changed overnight. Medieval practices lingered for centuries alongside new discoveries. Bloodletting continued even after circulation was understood. Purging survived long past its failures. Bad ideas don't die quickly. They fade slowly, and they take people with them. What finally killed medieval medicine wasn't one discovery. It was accumulated embarrassment. Too many contradictions. Too many exceptions. Too many bodies saying the same thing. At some point, even authority couldn't explain it away. Medicine had to choose between tradition and reality. And reluctantly, painfully it chose reality. Here's the darkest irony of this entire story. Medieval doctors weren't villains. They weren't stupid. They weren't cruel. They were trapped inside a system that rewarded certainty and punished doubt. And the moment medicine allowed doubt, everything changed. That doubt gave birth to modern medicine, but it was born slowly, messily, over corpses, and that leaves us with one final, uncomfortable thought. Medieval medicine didn't fail because people were ignorant. It failed because belief lasted longer than evidence, which raises a disturbing question. If we lived back then, would we have questioned it, or would we have trusted it to? Next chapter will end this. Journey by asking what medieval medicine teaches us about modern medicine, and why confidence can still be dangerous today. By now, it's easy to laugh at medieval medicine. Leeches, bloodletting, mercury, prayer mixed with poison, it all sounds absurd from a modern distance. We like to imagine ourselves as smarter, safer, more advanced. We look back and think, how could anyone believe this? But that confidence is exactly where the real danger begins. Because medieval medicine didn't feel ridiculous to the people living inside it. It felt authoritative, logical, proven. It was backed by centuries of tradition, respected institutions, and experts who spoke with absolute certainty. And that should make us uncomfortable, because those are the same signals we still use today to decide what to trust. Here's the most disturbing truth of all. Medieval medicine didn't fail because it lacked intelligence. It failed because it confused confidence with correctness. Doctors weren't guessing. They were sure, and certainty can be far more dangerous than ignorance. Medieval doctors believed so deeply in their system that evidence became optional. When treatments failed, reality was blamed, not the theory. When patients died, it was fate, sin, weakness, or God's will. The framework was untouchable, and once a system becomes untouchable, it stops being medicine and starts becoming ideology. That should sound familiar. One of the most mind-blowing historical facts is this. People in the Middle Ages trusted doctors more as medicine became less effective. As treatments grew more extreme, more blood removed, more toxins administered, the authority of doctors increased. Suffering was interpreted as proof of seriousness. Pain meant effort. Effort meant care. We still fall for this. The harsher the treatment, the more we assume it must be working. The more complex the explanation, the more intelligent it sounds. Medieval medicine thrived not because it healed, but because it looked like healing. And that illusion lasted for centuries. What finally broke it wasn't kindness or ethics. It was embarrassment. Medicine could no longer hide behind authority when outcomes became impossible to ignore. Too many bodies told the same story. Too many survivors contradicted the rules. Reality kept winning small battles until belief collapsed under its own weight. But here's the dark twist. Medieval medicine never truly disappeared. It evolved, it changed its language. It adopted new tools. But its deepest flaw, the worship of certainty, ever fully died. Even today, medicine struggles with the same temptation. To defend systems instead of questioning them. To protect authority instead of admitting uncertainty, to act decisively even when restraint might save lives. That should scare us, because it means the treatments we accept today aren't automatically safe just because they're normal. Normality is not proof. Consensus is not truth. And expertise does not equal Another unsettling fact. Many medieval doctors genuinely believed they were helping. They cried over patients. They prayed for them. They studied endlessly. Good intentions didn't stop the harm, and good intentions never have. This is the hardest lesson history teaches. Harm doesn't require evil. It only requires unquestioned belief. Think about how medieval patients felt. They trusted the system. They submitted to the blade. They swallowed the poison. They endured the suffering because experts told them it was necessary. Refusal meant being labeled foolish, sinful, or dangerous. And here's the truly haunting question. How many people today are suffering not because we don't know better, but because questioning feels forbidden? Medieval medicine teaches us that progress doesn't come from better tools alone. It comes from better questions. The moment medicine stopped asking, "What did the ancients say?" and started asking, "What actually happens?" everything changed. But even that change came slowly, painfully, over generations of unnecessary death. The people who suffered under medieval medicine never saw vindication. They never heard apologies. Their pain was simply reclassified as history. And that's how harm often ends not with justice, but with silence. So when we look back and say, "Thank God we don't live back then," we miss the point entirely. The real lesson isn't that medieval people were wrong. It's that they were confident. Confidence is seductive. It feels like safety. It feels like progress. It feels like control. But unchecked confidence is how systems stop listening. Medicine advances not when it feels powerful, but when it feels uncertain enough to question itself. The most dangerous sentence in any era is, "We already know," because that sentence was spoken by medieval doctors too. They knew the humors controlled health. They knew bloodletting saved lives. They knew pain was necessary, and they were wrong. So the final, unsettling takeaway of medieval medicine isn't about leeches or plague masks. It's about humility, or rather, the lack of it. History isn't asking us to mock the past. It's warning us not to repeat its mindset, because someday someone will look back at us and say, how could they believe that? And when they do, the answer won't be stupidity. It will be certainty. And that is why, after everything we've seen, you never wanted a medieval doctor to heal you. Not because they were cruel, not because they were ignorant, but because they were absolutely sure they were right, and history has proven, again and again, that certainty can kill just as effectively as any disease. There's a comforting story we like to tell ourselves when we look back at medieval medicine. The story goes like this. They were ignorant, we are enlightened. They bled patients because they didn't know better. We don't do that anymore, so clearly we've escaped the trap. But that story is not just wrong, it's dangerous, because medieval medicine didn't fail due to lack of knowledge alone. It failed because it trusted systems more than people, explanations more than outcomes, and certainty more than humility. And if you think that sounds outdated, you're not paying attention. Medieval doctors didn't wake up every day thinking, how can I harm someone? They woke up thinking, I know what's wrong, and I know how to fix it. That confidence is what made them terrifying. When a doctor believes doubt is weakness, patients become experiments in maintaining belief rather than lives worth questioning. The system for one of the most disturbing facts about medieval medicine is how rarely doctors admitted uncertainty. Saying, I don't know, was seen as incompetence. So instead, doctors acted. They cut, they bled, they poisoned. Action protected reputation. Hesitation invited suspicion. Doing something, even something harmful, was socially safer than doing nothing. That instinct never disappeared. Even today, systems reward action over restraint. A dramatic intervention feels responsible. Waiting feels negligent. Medieval medicine trained society to equate suffering with seriousness, and that psychological wiring still lingers. Pain looks like effort. Complexity looks like intelligence. Silence looks like failure. Here's a mind-blowing historical parallel. Medieval patients often felt relieved after extreme treatments, not because they improved, but because they believed something powerful had been done. Blood loss made them dizzy, which felt like change. Vomiting felt like release. Pain felt like proof. The body interpreted trauma as transformation. Placebo didn't disappear with science. It just got better branding. Another uncomfortable truth is that medieval medicine survived for centuries. Because it was socially protected, doctors occupied positions of authority. Their language was inaccessible. Their texts were sacred. Challenging them meant challenging the structure of knowledge itself. Patients didn't just trust doctors, they deferred to them. That dynamic hasn't vanished either. When authority becomes untouchable, mistakes stop being corrected. Medieval medicine didn't correct itself because it didn't believe it needed to. Evidence that contradicted the system was dismissed or blamed on the patient. Weak constitution, moral failure, divine will, blame always flowed downward. Here's something that should genuinely unsettle you. Medieval medicine was excellent at explaining failure. No matter what happened, there was always a reason that preserved the theory. If a patient lived, the treatment worked. If they died, the disease was too strong. If they worsened, the humors were resisting correction. The system could never be wrong by definition. And any system that can never be wrong will eventually become lethal. What finally broke medieval medicine wasn't compassionate, was contradiction. Too many people survived without treatment. Too many died with it. Too many surgeons ignored theory and got better results. Too many midwives outperformed physicians in childbirth. Reality became louder than explanation. But here's the part people rarely talk about. The transition was ugly. Doctors fought each other. Old practices coexisted with new ones. Patients became battlegrounds for competing beliefs. Progress didn't replace harm, it overlapped with it, which means people died during the improvement. That pattern repeats throughout history. Harm doesn't end before progress begins. It ends during progress, often unnoticed. And that raises a deeply uncomfortable question. What are we currently doing that future? Generations will quietly abandon without ever fully admitting was wrong, because history suggests we won't notice it in real time. Medieval doctors genuinely believed they stood at the peak of knowledge. They looked backward and saw ignorance behind them. They looked forward and saw refinement, not revolution. They couldn't imagine that their core assumptions were flawed. Only the details needed adjustment. That belief cost millions of lives. And yet, every era believes the same thing about itself. Here's another mind-blowing fact. Some medieval treatments accidentally worked, but for the wrong reasons. Certain herbs had mild antibacterial properties. Some fasting reduced complications. Some isolation slowed disease spread. Doctors took credit for outcomes they didn't understand, reinforcing belief in the wrong mechanisms. This made the system stronger, not weaker. Partial success is more dangerous than total failure. It keeps bad ideas alive. The same thing happened with bloodletting. In rare cases, it temporarily reduced blood pressure, making patients feel better. Those moments were celebrated. The countless deaths were rationalized. Success stories were remembered. Failures were normalized. Human memory is biased toward justification, and that bias is timeless. Medieval medicine also teaches us something deeply uncomfortable about expertise. Being trained can make you more dangerous when the system is wrong. Untrained caregivers sometimes helped simply by not harming. Meanwhile, educated doctors inflicted damage with confidence. Knowledge without flexibility becomes weaponized certainty. This is why the most revolutionary moment in medical history wasn't a discovery. It was the acceptance of doubt. The idea that a doctor could be wrong, that treatment could harm, that doing nothing might sometimes be the best choice. Those ideas sound obvious now. Back then, they were radical. But even today, they're fragile. Modern systems still struggle to admit uncertainty publicly. Errors are hidden. Language is softened. Responsibility is diffused. Medieval medicine didn't collapse because doctors were malicious. It collapsed because institutions protected belief over truth. And institutions haven't changed that much. So when we end this story by saying, "You never wanted a medieval doctor to heal you," it's not meant as a historical mockery. It's meant as a mirror, because medieval doctors weren't monsters. They were us with different tools, different language, and the same human flaws. They trusted systems too much. They feared doubt too deeply. They confused authority with accuracy, and they paid for it in blood. The most haunting part of medieval medicine isn't the leeches or the poisons. It's how reasonable it all felt at the time, which means the real lesson isn't about the past. It's about vigilance, about remembering that confidence is not proof, that tradition is not evidence, that suffering is not success, and that the moment we stop questioning healing is the moment it becomes something else entirely. That's the legacy medieval medicine left behind. Not horror stories. A warning: when we talk about medieval medicine, we usually focus on doctors, their tools, their beliefs, their mistakes, but the real story lives somewhere else. It lives in the people who trusted them, the ones who lay down on wooden tables, the ones who opened their mouths to swallow poison because someone in authority told them it would save their life. Most medieval patients never realized they weren't being healed. They believed that belief was absolute, and that might be the darkest part of all. Imagine being sick in the Middle Ages. You're terrified, you're in pain, you've watched neighbors die from illnesses that seem random and unstoppable. Then someone arrives wearing books, Latin words you don't understand. They tell you they know what's wrong. They explain it confidently. They give your suffering meaning. That alone is powerful, because fear doesn't just want relief, it wants explanation. Medieval medicine offered explanations for everything. Too much blood, bad humors, imbalance, divine punishment, cosmic influence. You weren't just sick, you were out of balance, and balance could be restored at a cost. One of the most mind-blowing truths is this: patients often thanked doctors even when treatments made them worse. Surviving letters and accounts show gratitude after bloodletting, purging, and painful procedures, not because patients improved, but because they felt cared for. Something had been done. Their suffering had been acknowledged. Pain, in this context, felt purposeful, and purpose is comforting. This is why medieval medicine lasted so long. It didn't just treat bodies, it treated fear. When a patient vomited violently after a purge, doctors said the illness was leaving the body. When blood flowed, they said the poison was escaping. When pain intensified, they said the cure was working harder. Suffering was reframed as progress. That reframing is terrifyingly effective. Another shocking fact: patients who refused treatment were often blamed for their own deaths. Refusal wasn't seen as caution. It was seen as stubbornness, ignorance, or sin. Trusting medicine wasn't just encouraged, was morally expected. Compliance became virtue. This meant patients didn't just submit physically. They submitted psychologically. They learned to interpret worsening symptoms as hope, weakness as cleansing, pain as necessary sacrifice. And when death came, families were told everything possible had been done, which was technically true, just not in the way they thought. Most medieval patients never questioned the system because they had no reason to. Doctors didn't look uncertain. They didn't hesitate. They didn't say maybe. They spoke in absolutes. They used ancient authority. They referenced God and nature and cosmic order. Doubt didn't live in that space. Here's something deeply unsettling. Many medieval patients died believing they were saved spiritually. Even if their bodies failed, medicine blurred into religion. Healing wasn't just about survival, it was about alignment with the universe. A good death mattered more than recovery. That idea softened the horror, but it also masked harm. Patients weren't just victims of bad science. They were participants in a worldview that made suffering meaningful. And meaningful suffering is very hard to challenge. Another mind-blowing fact: some patients actively requested harsher treatments. They believed mild treatment meant neglect. They wanted blood drawn. They wanted purges. They wanted pain, because pain meant seriousness. Doctors didn't invent this expectation alone. Society reinforced it. This is where medieval medicine becomes deeply human and deeply disturbing, because it shows us how easily people can accept harm when it's wrapped in care. Most patients didn't die screaming in rebellion. They died trusting, and trust is dangerous when misplaced. Consider how many people underwent repeated bloodletting while growing weaker each time. They noticed the decline. They felt it, but they didn't attribute it to the treatment. They attributed it to the disease fighting back, because that's what they were told. Doctors controlled the narrative, and narrative controls interpretation. Here's a brutal truth rarely acknowledged. Medieval medicine didn't just kill people, train them to reinterpret the experience of dying. Pain wasn't failure, it was struggle. Weakness wasn't damage, it was purification. Death wasn't evidence, it was destiny. That mindset made medicine emotionally immune to correction. And emotionally immune systems are the hardest to dismantle. Even when alternatives appeared gentler care, rest, isolation patience was suspicious. Doing nothing felt wrong. Rest felt lazy. Letting the body heal itself felt irresponsible. Action felt moral. This is why harmful practices can survive even when better options exist. People don't just want results. They want reassurance. They want to feel something is being done. Medieval medicine mastered that illusion. Another unsettling fact: some patients survived specifically because they avoided doctors. Folk remedies, rest, clean water, isolation, these often worked better than official treatments. But survivors rarely credited avoidance. They credited luck, God, or natural strength. Medicine still got the credit. Failure was personal. Success was institutional. That imbalance kept the system intact. Think about how many families lost multiple members to the same treatments and still trusted the process. Grief didn't break belief. It reinforced it. Loss was explained as divine will. Questioning medicine in the face of tragedy felt disrespectful. This is the quiet power of authoritative systems. They absorb blame and redirect doubt inward, and the patients paid the price. What makes this chapter especially haunting is realizing that most medieval patients never knew medicine was changing. They died during the transition, while theories were debated, while practices overlapped, while progress crawled forward. They were treated with methods already questioned by some doctors, but still defended publicly. History didn't pause for them. Their deaths became footnotes. And that's how most harm ends. Not with revelation, but with replacement. Medieval medicine faded not with confession, but with forgetfulness. New ideas quietly took over. Old practices were slowly abandoned. No one gathered the dead and said, "We were wrong." The suffering simply stopped being mentioned, which leads to the most chilling realization of all. The people who suffered under medieval medicine never knew they were part of a failed system. They never got closure. They never knew the pain was unnecessary. It announces itself as help. Medieval patients trusted medicine because it sounded certain, authoritative, and meaningful. Those same traits still persuade us today. So when we say, "You never wanted a medieval doctor to heal you," what we're really saying is this: you never wanted to be inside a system that couldn't imagine being wrong. Because the most dangerous thing medicine can lose isn't knowledge, it's humility, and the people who suffer most are always the ones who trust it the most. It is a miracle that humanity survived the 14th century. Looking back, it's easy to call these doctors madmen, but in a world of darkness and plague, they were the only ones brave enough to try something, even if that something was a red-hot iron or a handful of leeches. But if you think their hospitals were a nightmare, wait until you see where they kept the survivors. If you want to know why people in the Middle Ages literally prayed for death just to escape their prison cells, click the video on your screen right now. Stay curious, stay grateful for modern medicine, and I'll see you in the next dark chapter of history. This is the Midnight Historian, signing off.